I'm with Dr. Churchill, who is a medical doctor who works in
naturopathic doctor.
Naturopathic doctor who works in functional medicine.
Correct, yes. Functional medicine is kind of the big overall discipline, but I've also incorporated, we used to call it anti-aging, now they call it age management medicine, which is definitely a different slant than functional. Functional is more finding pathology. Age management is much more geared for prevention and wellness and literally slowing down the aging process, slowing down the metabolism. And then also I have regenerative medicine too, because we've done now a lot of patients or a lot of the public doesn't understand what regenerative medicine is. So it can be anything that helps the cells regenerate rather than just heal the cell. It actually forces the body to bring new cells and create like a new, so say in the knee, you have a cartilage, you can create new cartilage, or in the shoulder or in the back. And that's the orthopedic injections that we do for any joints. Back pain, we have a lot of really great results with back pain, intractable back pain, 10 out of 10, you can barely get out of bed. Yeah, well, we also we have exosomes, we use Wharton's jelly, which is from placenta. Everything I use from placenta. I don't do bone marrow or fat stem cells in my office. We don't do those. They're fairly complicated procedures. So we buy it from reputable labs, which all come from placenta, which is tested very carefully. But we also have ozone. And in Germany, 50% of the doctors in Germany use ozone every single day.
What is that?
Ozone's a gas, it's O3, and we have an oxygen tank. We run it through a machine and makes a gas called O3. Decrease inflammation. It's probably one of the best things for decreasing inflammation in the body, locally or systemic through an IV. You can use it vaginally, you can use it rectally, a lot for cancer, especially rectal cancers, things like that. Change the whole vaginal flora, the ecology of the vagina, everything. And then we use other things like PRP, that's a little bit older.
What is that?
PRP, you spin your blood down and you take the cells that are left in the clear liquid, and you can always tell a patient's really good PRP, so it's like golden and it's beautiful. We know we want to use that. We can do facials with it, regenerate facial tissue, increase collagen, elastin. We inject stem cells at strategic places, nasolabial. Like if I injected a good cc, 2 cc's in your nasolabial folds there, we could literally get the face to start to lift up again. My wife, we just did one on her, and it was only like 3 days later. I'm like, oh, nothing changed. And I know it takes 6 weeks, but she's like, yes, today I feel my face fuller and it's firmer. And she's 60, oh, I shouldn't say that. Anyway, she's doing really good. So wow. We do that. And so a lot of things can be done with regenerative medicine. There's so much research out there now. There's so many things we can do. But I'm a mad scientist, and I get bored easily, and I learn things pretty quickly. So I got into peptides. Peptides is it's usually some substance in the body that they're making in the lab. They're mimicking that, like TB500 for joints or BPC157. That's a big one for the gut. But we use a lot of them to raise IGF-1 instead of using human growth hormone, which is in the past, kind of not all doctors, but there were some kind of different, some like Schallenberger and those guys were at the beginning of it, and the FDA hated it. Now it's become much more commonplace. But I mean, if you're going to use HGH, your IGF-1 has to be below 72. You have to, and there actually is a diagnosis called adult growth hormone deficiency, and you don't want to have that. And I see guys at 40, 50 years old have a IGF-1 of like 72. It's from stress, from COVID, from virus, from bacteria, from chemicals, just the whole body. And you can see when someone's going to be sick, their IGF-1 is really low. So I like to try to raise that up. I do all the hormones in my practice. So I look at pathology differently than a lot of doctors. Because if your endocrine system is really going great, your testosterone guy is 1,000, women it's normal, women have it too. If all your hormones are pretty normal, you're going to be able to fight almost anything. And I didn't know this. I've been going to a lot of different lectures recently, and I always wondered, what's the relationship between the immune system and the endocrine system? They're very intimately connected. So, and I know I do a lot of things through intuition. So over the years, I've been treating the immune system, and that's the gear towards, the labs I'm doing is geared towards looking at your immune system and your endocrine system. But the panel we use, the blood panel, I've researched over the last like 15 years what companies are the best to save money for patients, because if you do a lot of markers, if you use the major company, they're going to charge you a fortune. So we have a company we're doing now. It's about 10, 12 pages to what you order, and it's geared towards heart. Because heart disease and stroke and diabetes eclipses everything in this country. It's even way more than all the cancers put together. So you know how many, it's like 60, 70% of the people in the world in our country have what they call insulin resistance. And another, I think it's 30 or 40% all have diabetes. And there's another 10, 20% don't even know what they have.
Well, they don't know.
It's so dangerous for them. It's going to lead to massive amounts of problems. So our lab gears towards that. It's like 2 pages just on the fatty acids in your heart, the inflammatory markers. That's the most important thing, because inflammation now is the name of the game. And as we were talking about before, that LPS layer, that endotoxemia, which a lot of people don't understand, but it's your leaky gut.
Your leaky gut.
It's like a buzzword, right? And I used to think, I thought, leaky gut's no big deal. You don't have Crohn's or ulcerative colitis where you have like bouts of diarrhea and blood. No, you just have some leaky gut. And no. It's really getting more and more research on this. So we know that LPS layer is literally going from the gut. Remember, your gut is your second brain. It's your enteric nervous system. So important to understand this for patients, because those LPS layers from the bacteria stimulate the immune system like crazy. They make them berserk because they know they got to go kill. It's like search and destroy. So, because they're the outside layers of the bacteria. So much bacteria is going in through your gut, gets into the bloodstream. That's when you got the problems. Allergies, food sensitivities, you can get parasites, all kinds of bacteria. But they're seeing it's translocating to the brain from the gut and going across the blood-brain barrier. So a lot of the research now is looking at Alzheimer's and Parkinson's can be from that LPS layer, stimulating inflammation in the brain. And the reason why you get Alzheimer's, at least, is because the brain's trying to calm everything down with the tau, the neuroinflammatory tangles, and also there's also another protein, I forget the name right now, but these proteins they'll stimulate the immune system in your brain to start trying to kill everything. And literally they'll just start taking chunks. It's like shotguns. They don't know what they're shooting at. And that's a lot of the problems with Alzheimer's. We have a really great system now to detect that. Another thing I want to get out in this tape is if you have any idea that your parents had Alzheimer's or anybody in your family had dementia, early dementia or neurodegenerative diseases, do a PET scan, PET. PET scan is the only thing that's just come about in the last 10 years that can look for those neurofibrillary tangles and the Dow proteins and the things the amyloid plaques. That's what I was trying to remember before. Those are the things that you're going to find. But what we want to find them is 20 years later, where they're just starting out. Because if they get going, it's almost impossible to change it. And we know right now, average Alzheimer's patient, if you have the money, costs $350,000 to take care of them after they can't do their activities of daily living, which is the end stage of Alzheimer's. There's many. It's really saddening to see what's going on. But that is saying that guy, Dr. Bredesen, others have actually done research, looked at the drugs, and the drugs don't seem to do a whole lot, and some of them seem to do damage. But if you really, why I like Bredesen's stuff? Because it took in this consideration everything I've ever learned. And that's how hard it is to fix Alzheimer's. But if the patient's willing, we have the labs, we have the treatments, and it's an ongoing process. He's shown we can turn those patients back around. It's amazing. I love that stuff.
Well, it's very interesting because my mother just passed away from Alzheimer's.
Wow.
And nobody wants Alzheimer's.
No.
Let me tell you what I saw. But how do I know if I'm inclined to have it, or my brother?
We need to do an ApoA4. There's a lab. It's not
Okay.
the definitive answer to everything, but if you have it, it's almost 100% you're going to get it. And the PET scan, that's what I'm saying. You can see years before.
And the chances are very high that I'll get it, but I want to prepare for it before I get it.
How old are you?
73 years young.
No.
The good news is I'm old enough.
If you're not putting your keys in the refrigerator. So for the public, I want to say, because this is interesting, it's not like you go into a room and forget what you were going to do in the room before where you were. That's not what it is. I mean, what I've been told and what I've learned is like, okay, if you come in from the car and you put your keys in the refrigerator and then you don't know where they are at all, you can't find them. Okay, this is getting to be a little borderline. We need to start looking at this.
Well,
But there's a test called the MoCA test, the Montreal Cognitive Assessment, and I've done a lot of them. You can see pretty fast what's happening.
but it's funny, when you mention this, I know people that do that.
Send them to me right
Yeah,
away.
yeah,
Don't
but
wait
I would-
around.
Up until
It's
this
so
meeting
hard to
with
fix
you,
this. Yeah.
I would have no idea where to send them. We don't know.
There's not many doctors doing it.
No.
I mean, Bredesen's teaching, he has a whole school teaching this philosophy now, but there's not that many doing it. It's long, it costs a lot of, not a lot, but it costs money. You got to take your time already. If you're practicing, it's not simple. But I heard him speak at a lecture. So the name you want to remember is Dr. Shaw. Dr. Shaw I mentioned earlier in another video.
Right.
He's from Great Plains Lab, literally Asperger's syndrome.
Wow, that's another biggie.
Yeah, but Asperger, he's got like one of those heads, those craniums that's massive. He's a genius. And what he did is he titrated or tailored down everything he knew into like autism and just study, because you don't do the stuff outside. I guess I'm not making sense, but you're not very social. Asperger's, you don't want to, it's really hard for you to make any friends. And so what do? Just take one thing you're good at. And if you if you can have a great future, it's hard. I guess he had some help along the way, and he probably did some of his treatments to himself. But he looked at he has a really great, amazing organic acid test, and then there's mycotoxins, the mold toxins. That's another big one with autism.
Okay.
And dementia, really bad. And a lot of people don't know they have it. His labs can test for that though, easily. And I've seen it on labs, off the charts. I have to say one thing, there is a patient, dear to my heart, mental illness, no mental illness, I don't know. She came in, she was a hard patient to treat. We did a lot of labs. She had some of the worst mold mycotoxins I've ever seen in my life. She called the other day and said that you need to send my labs right over, because she was in a mental hospital and they wouldn't let her out because she's saying she had parasites and they didn't find the parasites in the labs. And this is a lady, she's pretty sane. She's a psychologist.
Yeah.
And literally, I emailed her. I don't know if she could get it. I'm like, we got to send this to you, because this was late. I got these labs after she left the practice. And I'm going, oh my goodness. And from what Dr. Shaw and those guys talked, I hadn't treated patients with this before.
Right.
Literally, you could go insane with this amount of mold literally going into your brain. So mold's a hard one to find. But even in California, where it doesn't rain a lot, there's a lot of, and it doesn't have to be water damage, but there is some water damage. It could be a lot of foods that you eat. Literally, if your immune system's weak enough, or if the mold itself, what it does is it shuts down your immune system. It's very smart. And at that point, basically, it can grow. It can grow all over the place.
What does the future of your medical practice look like? What have you learned in the last few years, maybe the last few months? I mean, it's changing so quickly.
Do we have enough time?
No, you don't. You have to be quick. But you know what?
The future? Oh my goodness. Do we have so
How
many?
excited are you?
Well, I try to stay baseline, because I used to get too excited and I don't want to go all over the place, but pretty happy about what's going on. I mean, we have offers to set up clinics in like a lot of places around the country. I have the project in New York, in Middletown, where I know the director's already bought up really beautiful practices in Park Avenue, because Middletown, you have to make money, right? You have to fund what you're going to do. And that's kind of hard to get super wealthy people who can afford, it's plastic surgeons and a lot of the regenerative medicine things. So basically he's bought a clinic in Park Avenue and one, I think, in Columbia University. And those doctors have come on literally to the school in Middletown. So it's a conglomerate.
Yeah.
It's not just in Middletown. It's like that idea of compassionate medicine, and the people that were there, the geniuses that came there and presented 2 weeks ago, it was just amazing. And a lot of it was Chinese medicine and relating the spiritual to the physical.
I love that.
Bridging the gaps.
I love that.
And to be able to share that with people in a lot of different ways. Because a lot of people learn at different levels. Remember, I can't start teaching you at my level what I've learned spiritually in 32 years. I have to meet you where you're at. The first thing they taught us in medical school, with your energy, I can't start filling you full of all these amazing medicines if you have cancer, because you're going to get really sick. I have to take you up slowly. So the same thing with people coming into a new clinic or a new idea, a lot of education, there's a shakedown period. But if you can meet each person with this thing and it helps them in that thing, then you'll have the word of mouth that'll spread. And that's what they're doing right now. And they're looking for donation, and they have a lot of good people that are helping them. So anyway, that's part of what I'm going to be working with them to help set up their IVs and set up their different medicines. And then we have another guy just came into my practice. One of my patients wants to work with me and help me with, I'm not so good with money, so help me with the finances and get everything organized and start to branch out. He's pretty excited. And there's a lot of other things coming. There's so much research coming and new machines coming out. Like, I never really liked machines. I didn't think they were worth much, but there's some really brilliant science coming out of Europe and Asia now, and they're translating into machines. So we're going to be having them in my practice soon. Shockwave, we just got a shockwave machine. There's a whole page on my website about how the vibrations, the acoustic vibrations heal. So for ED, erectile dysfunction, it's like the best thing you can do for men. And we already started using it, and we can see the results, other than testosterone, because some guys don't. Oh, this is interesting. So if you give testosterone and nothing happens, you better start looking for heavy metals. Because the testosterone, okay, if it's low and you raise it up, that's fine. But if the vessels in the penis, this is what we're talking about now, that's when a guy won't go to a doctor unless something happens to his penis usually. But the heart vessels And they're the similar vessels, right? So if they're clogged up down there, or there's some plaque or things in those vessels, then the heart's pretty much going to have, similar issues. So we need to look for heavy metals, especially in young guys, 20 and 30 years old. This is happening to younger and younger guys now.
Yeah, I think things are changing. Tell me about, what is your website?
TheChurchillCenter.com, TheChurchillCenter.com. Yeah, it has all the treatments on there. It has amazing amount of information. We just, last month, we put a whole page on regenerative medicine, and now we just put a whole page on the shock wave, and it does cellulite. So a lot of the women, we have after and before pictures, in the butt especially.
Yes.
Yeah, they don't like cellulite. We need to get rid of
No
that
way.
at all cost, right?
Any cost.
Yeah.
That's a no-no.
So that's really great. And then we're in Fullerton. We have a 6,000 square foot facility. Really beautiful. It used to be an old acupuncture clinic. So a lot of small rooms, but a lot of inlaid wood. And the lobby is about 75 feet by 50 feet. And then the rotunda, we have the rotunda. It's beautiful marble. We have a southwestern motif with cactus. And it's just beautiful. People say it looks like a 4-star hotel. So I want the people to be calm when they come in. I don't want to have like a stark, ugly, smelly, bad vibration office. Because as soon as you walk in there, like, oh man, you're looking at your magazine, you're like, what's the doctor going to do to me? No, we don't have that in my clinic. It doesn't happen.
It's funny you say that. In the doctor offices I've gone to, sometimes there's no vibration. It's not a good vibration.
Yeah.
I don't feel comfortable.
Right.
And I start getting nervous.
Yeah, of course. Energy is everything.
Energy
you can't
is everything.
see it, but it really is everything.
And when I go to somebody who has that kind of office calming, I just love it. I'm a different patient.
No, you heal much faster too, because every cell in your body is picking up on that energy. You can either heal, okay, just an example. A lot of times I do the Qigong in my house that we practice, and there's cactus, and I just put them out there, and the one cactus, when it's not in that place, it starts to curl the leaves on. As soon as I just look at it today, every single one is spiked straight up. And it's rare for those cactus to be
No, very.
And then the avocado tree, which we grew with almost no dirt, is 16 feet tall. It's literally that wide in the last year. And I can't attribute it to anything else because we don't feed it. We water it, but so the energy will really heal. If your energy is good, you literally can heal other people. I don't do that. But it's possible that if you're nearby somebody and if your energy is really pure, you literally, and they could stop to curse at somebody, they could stop to do something bad if you walk by them. Wow. If you can go high enough.
I love that concept.
A barometer of like pure energy.
Because I'm high energy.
Yeah.
And every day I want to be a little higher. I'm a 1%
pure,
better every day.
Not just high, you need to be pure.
Pure.
And
pure.
good. Yeah, pure. The denser it is, like in homeopathy, the higher the remedies we use, the denser, the purer it is, the less in homeopathy, it's a little bit of energy. So we'll use like eagle's blood or something, or you use a plant or a mineral. So let's take eagle's blood. That's really cool. I love that. And you take 1 drop of that in 99 drops of water, 1 drop of that in 99, 1 drop, all the way down to 1,000, 5,000, 10,000, and up to 100,000, right? Like 100 M in homeopathy, we almost would never give that dose. Because if we matched it up perfectly, the patient's symptoms, oh my God, fireworks. They'd almost turn back to the way they should be in like a week, or they couldn't handle it. No. They'd be pulled in all these different ways. So we'd start with a really low dose. And some patients have had 1 pellet in a quart of water, dip a spoon and touch the spoon to your tongue. She literally had reactions, and it was from the remedy. It wasn't from anything else. But she healed. We knew she was going to heal because it's such a small amount of energy that if you don't match it up perfectly, that's why a lot of people say homeopathy doesn't work. But we had some great mentors, genius people that taught us how to take the case, how to find the right rubrics, they're called, but the right terms to put in the software, and all the remedies come up to the front. And you give it, we changed people's lives with that. Very powerful medicine.
Well, how do I find you? I'm just so interested in what you've been saying. I love learning about health because health is your wealth.
It's everything. Yeah.
And as I age a little bit, even though I get younger every year, I still need to be concerned with it.
You look pretty young. I wouldn't say close to 70, so keep up the good work. I'm on the internet. I have quite a few pages. If you go through the different pages, a lot of good reviews. Just Dana Churchill or Dr. Dana Churchill. I'm on there. Eventually, you'll get to the British people, though. You'll get after I stop, then the British start coming in there. So
they will.
I'm not. Our family wasn't related to Winston. It was way far back, anyway. So you'll see on the internet. But thechurchillcenter.com or my old website is drdanachurchill.com. The new website, which is much more beautiful, has a lot more information, is thechurchillcenter.com. For whatever reason, we kept them both on the internet. So or just call us in Fullerton. I'm in Fullerton. Arcadia, I'm in Arcadia 1 day a week on Thursdays also.
Now, where's Arcadia? Just so I know. I'm from Arizona.
Oh, Arizona. Okay. Well, Arcadia is like, they call it the Chinese Beverly Hills.
Oh,
It's really beautiful. It's like just south of Pasadena.
okay.
And it's near the Chinese area, but it's like the upscale, really beautiful area. So we have a lot of Chinese people coming in. We have Chinese translation. My wife's Chinese, so if you're hearing this and you want to come in, just ask for my wife, Cindy. She speaks Chinese fluently. She brings a
Beautiful.
lot of Chinese patients in. They have a radio station. They're doing advertising. And the Chinese love to do the stem cells. They love the whole regenerative medicine thing. It's just wonderful. They support us a lot. I'm kind of Chinese now after all these years. I make sure I take my shoes off immediately. I don't wear the slippers for the kitchen in the house ever. Yeah, there's and you have to be very.
Right. It's a different
way.
way.
It's a different way, yeah.
It's a different way, which is a good way.
Yeah, the people are amazing people. Most hardworking and trusting. Once they trust you, it's like for life. Great people.
That word trust, I can't tell you how important that is,
Yeah.
especially today.
Yeah.
You know,
And there's
they,
so
they
much
read
stuff
the
out there, you gotta
newspaper,
cut
they
through.
watch the TV. It's been awful in the last couple of years.
I know.
And
What do you believe anymore? It's so hard to understand what's the truth.
It's all about us. It's the inside, as we talked about earlier.
It's so interesting because when COVID first hit, the doctors were researching and these papers coming out and they're debunking and all this like agendas and everything. And I was like so caught up in it for a while. All of a sudden one day, wait a minute, how's this affecting me? It wasn't. It was not affecting me in any way, shape, or form, except for my mind would be going out to it. So I said, what if I just shut that down? I don't look at YouTube or any of that, right? And all of a sudden one day I'm like, I just go from my house to my work and I'm really diligent, help every patient. I do more chart noting. I do the homeopathic remedy and I do this for everybody. It was amazing. Everything got better. And I had no anxiety anymore. And what's his name? Not Jeffrey Bland, the guy from Arizona, University of Arizona. He's a big proponent of natural medicine.
Okay.
And Andrew Weil.
Andrew Weil. Yes, I do know.
He said back in the 80s, take a news break.
Right.
And that's when the news was somewhat normal, right? Even then people were, how the news wants to sensationalize everything? Well, that literally goes into your brain and increases your stress every time. And I could tell you the mechanism just by watching those movies with the fighting or the killing and all that. One last thing I want to say, kids, there's a research article the other day, kids who were playing the video games, a lot of video games, but they nailed the ones that were killing people, war games, right? Some of them were having heart attacks. Kids.
No way.
9 to 16 years old.
What?
Yeah. That's how detrimental this stuff is because it's your choice. You made the choice to do it.
Right.
So you're going to get that energy. It's not like you went and killed somebody, but you still get that energy because you love this. You think it's fun. You can't live like that. If your thoughts are like that, you're going to have a lot of trouble. Maybe people don't understand or believe that, but I can tell you it's true. I mean,
Thoughts?
I've had one bad thought sometimes, literally stubbed my toe, almost broke my toe once. Things have happened to me. Oh, this is a perfect case. My wife, we went to Canada. They wanted me to just be in this Chinese band, right, where they play the drum from a long time ago. And you have to do 2 different things with your hands. And I'm not very good at that, right?
I'm not either.
So they get me there, and I know they were all laughing. It wasn't good fun, but I don't like to take laughing about myself too well, at least back then.
No,
It was a very good test for me, right?
Yeah.
But I didn't pass the test. I threw the drum down. I sat in my car, and it went like this, right? A branch fell from about 20 feet up, about this big, hit my car, slam. And everybody stopped, and they're just looking. They're like, see what happens to you?
See what you were putting out.
Bad thinking. I'm not going to do this stupid practice. Why do I have to be here?
Bad thinking,
instant karma.
bad results, karma.
But it's better to get it instantly than wait all of it to be balled up in one later, 10 years down the road, right?
That is correct.
Pay back early, right?
Right. Well, thank you for sharing all this
My
information.
pleasure.
I loved it.
My pleasure.
You were great.
Thanks for being a great host.
Thank you. And I love doing it, so it has great results.
Cool.
And I want to say thank you for everything you do for people.